Today I'm going to ask what's the difference between laser and IPL hair removal. So let's first look at the differences between these sorts of systems. Well, all lasers can generate a single wavelength, whereas IPL can generate what we call a broadband output, typically be somewhere between 400 and 1200 nanometers, which we then use filters to filter out the wavelengths we don't want. Most lasers can generate a usable fluence up to about 40 joules per square centimeter, although diodes can go much higher than that. And your typical IPL system should be able to generate something like 100 joules per square centimeter. Most lasers can generate something like 100 milliseconds, similar for IPL systems, or longer if they use more pulses, more subpulses. And your typical laser will output mostly they'll output circular spot sizes in the millimeter range, whereas diodes can usually generate a square or rectangular spot size, which is made up of an array of diodes. IPL systems use glass or quartz or sapphire crystal tips, and these could be up to about 40 by 15 millimeter in area. So what are the important wavelengths? Well, if we look at the main chromophores in skin, that's melanin, oxyhemoglobin and water. Well, the 1064 from the Nd:YAG is infrared, and it's absorbed by all three chromophores. The diode laser is typically around about 810 nanometers, also infrared, and it can be is preferentially absorbed by melanin compared to oxyhemoglobin. The alexandrite at 755, also preferentially absorbed by melanin. Ruby laser at 694, although the ruby is not particularly good because Q-switched laser pulses are too short to have any real effect on hair follicles. The dye laser, which we used back in the early days for port wine stains and blood vessels. KTP laser, which is 532 nanometers, a green beam. But you can see here that the absorption difference between blood and melanin is not so great, but it's more strongly absorbed in blood. And then you've got argon lasers, which were these are quite old systems, which were used a long time ago for photocoagulation and eye surgery. And the IPL typical range, like I say, somewhere between about 400 and 1200 nanometers, which if you use the correct filters, you can then differentiate which chromophores will absorb which wavelengths. So if you want to treat hair in darker skin, then your target chromophore is melanin, and we would typically use a filter somewhere around 690 to 700 nanometers. So this will only allow wavelengths from that level up to 1200 to get through to the skin. So it'll be absorbed in the melanin, but it'll have less absorption in the epidermal melanocytes and the melanin there, which means you'll have less damage potentially compared with a 640 filter like this one. So this filter would be used for hair in lighter coloured skin, and in that way you, in this case, you can damage the hair, hopefully preferentially, compared to the basal layer melanin. Also, you can see from this graph that the melanin absorption is much stronger than with hemoglobin or oxyhemoglobin, so you shouldn't damage blood vessels using these wavelengths. But you can also see that there's beginning to have significant water absorption as well, around about 800-900 nanometers and above, and this will lead to some thermal pain in the dermis. To target blood vessels, we want to get enough energy into the hemoglobin and the oxyhemoglobin, so we would use a 530 filter like this, and that allows through some green and yellow light, which you can see on this graph will be absorbed more strongly by the hemoglobins compared with the melanin. You still get the higher wavelengths, which means you will get some absorption in melanin, both in the epidermis and in hair. And then for the treatment of pigmentation and acne, we would use a lower filter, something like a 430, and that allows through the blue light, which is very strongly absorbed in pigmentation in the melanin, and also in the P. acnes bacteria. So this filter is good for treating a whole range of difficulties in the skin. And what about the penetration of light? Well, I often see some misleading images online which try to negate the effectiveness of IPLs, and they're quite wrong. When light fires into the skin, it will encounter atoms and molecules in the skin, and this will inevitably result in scattering. And so any beam that's fired into the skin will begin to spread out fairly rapidly. And it doesn't matter if we're talking about IPL light or laser light, the beams just spread out. It's inevitable. So you have to keep this in mind, that whatever fluence you are firing at the skin surface, it will decrease with depth, purely because of the scattering effect of the skin. And then we can compare the penetration of light due to spot size. Now, it's been well known for some time that small spots cannot really penetrate energy too far into the skin. They just don't. Larger spot size will penetrate a little bit further, and then larger spot size again even further. So this gives an advantage to larger spot size systems, including IPLs. It means that you can get more energy into deeper portions of the skin, with obviously better results as a consequence. So always go for the largest spot size you can, while maintaining the fluence that you require to destroy your targets. So what are the advantages of an IPL system? Well, because of the wide range of available wavelengths, you have a wide range of treatment applications, including hair, blood vessels, benign pigmentation, acne, and skin rejuvenation. You also generally have more control over the outputs, so you can set up a fluence that you require with a corresponding pulse width, which is your cooking time. And generally speaking, most IPL systems will have a decent contact skin cooling designed so that you can protect the epidermis and the upper dermis at the same time. Lasers don't quite give you such a range of controls, but they do have some advantages. Diode lasers, generally speaking, are better for darker skins because it uses a higher wavelength, around about 8-10 nanometers. And Nd:YAG lasers, this is the long pulsed systems, are better for black hair and black skin because they are less likely to damage the epidermis and the upper layers of the dermis. So how do you choose which system is best for you? Well, the first question you need to ask is, what do you want to treat? If you are treating just hair, then you may find a diode laser is easier and better. IPLs are trickier to use, so why not go for an easier option? You might also have to consider which skin types or skin colours you're treating regularly. If the skin colour is lighter, then IPL gives you more options. If you're typically treating darker skinned patients or clients, then a diode laser again may be a better bet. Obviously there's the cost to consider. You generally find that IPL systems are cheaper than a lot of laser systems, but also you need to consider the cooling system, because cooling is absolutely critical in obtaining good results without damaging the tissues. If your system's got a good cooling system built into it, then that's great. If it doesn't, then you have to purchase a separate system, a forced air cooling or cryo system or something like that, and that will add to the cost of your overall costs. And always keep in mind that, particularly for hair removal, the risk of damaging the surrounding tissues depends greatly on what you're treating. If you've got dark hair in a light-skinned individual, then the risk is relatively low, because most of the energy will be absorbed in the hair and not so much in the epidermis. However, if you have a lighter coloured hair and it's a darker skinned individual, then the risk is definitely greater. all comes down to the contrast between the colour of the hair and the colour of the skin. You can see here that for dark hair and light skin it's a large contrast, whereas light hair, dark skin is a lower contrast, and the contrast essentially dictates the risk of tissue damage, particularly in the epidermis and the upper dermal layers. So keep this in mind always. So in answer to the original question, which is best, the answer just really depends on what you want to treat and your patient selection. I would normally recommend, if you're just doing hair removal, then possibly a system dedicated for hair removal is ideal. If it's darker skinned people you're tending to treat, then probably a diode laser is up your street. But if you want to treat a wider range of applications, including blood vessels and pigmentation, acne, etc., then an IPL would be a better choice. It just gives you a wider scope compared to lasers. Hope this helps. Have a wee look on our blog here and on our YouTube site, and you can find some more stuff. Thanks for listening.